Immunity. Immunity is the ability of body to resist disease and pathogenic antigen with the help of defense mechanism of body and various antibodies. Classification. Immunity. Innate immunity. Acquire. Innate, specific, non-specific. Acquire, active, passive. Innate immunity. It is inborn capacity of the body to resist the disease of pathogenic organism. This type of immunity represents the first line of defense after the birth of individual. Specific innate immunity. It specifically recognizes the difference between the self cell and foreign cells. Specific innate immunity acts particularly against the specific pathogen. Example, it adds specific antibody to carry out the immunological function. Non-specific innate immunity. It mainly involves generalized protection of human body against the infection agent with the help of skin, mucous membrane, gastrointestinal barrier, respiratory tract barrier, etc. Mechanism of innate immunity. Epithelial surface. The innate skin and mucous membrane covering of the body provide considerable protection against the pathogen. They also produce certain bactericidal secretion in the form of enzyme, fatty acid, etc. The acid secretion of stomach inhibit the tissue defense. It is barrier of body are overcome by the pathogen and pathogenic agent, then other various factors are present in tissue body fluid for defense purpose. Such tissue factor may be divided into following mechanism: inflammation, phagocytosis, inference, natural killer cell. Acquire immunity. It is mainly carried out by following mechanism: humoral immunity, cell-mediated immunity. Humoral immunity. It is derived in name because it involves the factor which are formed in human. Example, bodily fluid. It is antibody-mediated response which involves B lymphocyte B cell. These B cell mature in bone marrow. Humoral immunity. B lymphocyte blind to antigens. Foreign body pathogen surface antigen. Plasma cell. Antibodies, destruction of pathogen. Memory B cell, secondary exposed plasma cell. B cell is circulation comprises about 10 to 15% of total lymphocyte. The memory B cell can remain in the body for many years. If next time the body get exposed to similar antigen, then it destroy the pathogen. Cell-mediated immunity. It is mainly carried out with the help of T lymphocyte T cell. T cell mature in the thymus gland. Type of T cell: helper T cell, CD4 cell, cytotoxic T cell, CD8 cell, suppressor T cell. Pathogen invade body cell or pathogen are taken up by pathogens. Surface membrane. Specific hyper T cell bind antigen via receptor activate of hyper T cell. Activate cytotoxic T cell. Destroy antigen presenting cell. Helper T cell. Stimulate B cell secretion antibody. Stimulate phagocytosis of pathogen. Develop memory T cell. Activate on next invasion. Acquire immunity may be active, passive. Active immunity. It is resistance developed by the immunity which gained by the antigen stimulus. Nature active immunity. It is acquired after the recovery from the disease due to infective organism. Artificial active immunity. It may be acquired artificially by inoculation of various bacterial viruses. Example, living organism, smallpox, BCG. Kill organism killed by heat or phenol without changing the antigen structure. Typhoid vaccine, cholera vaccine. Thyroid. It is the inactivate barrier toxin which is non-toxic but remain the antigenic structure. Example, tetanus toxoid. Passive immunity. Here the patient is immunized by the already prepared antibodies. Natural passive immunity. During intrauterine life, the transmission of antigen antibody mother to features through placenta. Also the antibody get transferred by the colostrum, first breast milk of the mother. The antibody received by these above sources protect the newborn against various infections like milliasis, mumps, smallpox, tetanus. Artificial passive immunity. Immunization. This case is passive and it is produced by ingestion the antibody present in the serum of the animal which have been immunized actively. Antibacterial serum. Here the antibody are produced by injecting the barrier into the animal. Later the serum is collected by anthrax and pneumococcus. Antitoxic serum, antiseria. It is produced by the injection the toxoid in animal of the animal which has high amount of prepared antibodies is used. Example, antitoxic serum against diphtheria, tetanus, etc.